clinic where we have treated over the decades, and it stuns me to say the word decades, our HIV patients, those who are HIV infected and those families who are affected. I think I have come to Thomas Street for decades, and certainly I remember as a member of the Houston City Council, then Mayor Whitmire beginning to sending me to Washington with the announcement with Senator Kennedy of the Ryan White treatment dollars. That is history, but that was when obviously HIV in the early 1990s was raging, and Thomas Street was the valiant fighter. It was the medical facility that treated these patients with love. Part of the Harris County health system. No patient was turned away. No patient without health coverage or a home. None of them were turned away. And I think it's important as we celebrate the advancements in Thomas Street to let people know that Thomas Street was once the place and the only place that if you were infected with HIV, if you had active AIDS, if you had AIDS, then this was the place. And there were few other places that you might be able to go. The Harris Health System then, the Harris County Public System was, I need to move that because the Harris County Public Health System was the system that took care of our patients, our neighbors, our family members. And they took care of you irrespective of your language, your status. I know it because I came here and saw the hallways and saw the rooms where you were being taken care of. So I couldn't think of a better place to come, Commissioner Garcia. Thank you for having us in your Commissioner Court district. Thank you, Commissioner Ellis, for joining us as his partner, and of course Judge Hidalgo and the Commissioner's Court, because this is a federal county government partnership. I'm excited about that. I'm excited. And so let me just give a few points, and I want my colleagues, I do want to acknowledge, we'll be acknowledging our doctors here. So excited about your work and excited about the work that's being done here as quickly as possible. Let me remind you that it is important that we know that 556,000 souls have lost their lives with and counting, even though there is a bright light, have lost their lives to COVID-19. Something that started, and we were baffled, we were confused. We were in an administration that was denying and making humorous words, calling it a name, a country's name, stoking hatred against Asians. Oh my God, what we lived through, and people were dying. And so out of that, Texas had 2.81 million cases of COVID-19, continuing the denial, unfortunately, in the beginning, and then 48,986 deaths. Houston and Harris County had 380,238, and then recorded some 3,737 deaths. But thank goodness for the county and the city, they were fighting all the way. They never stopped fighting. They never denied science. Thank you for not denying science. And you took it seriously, and we began to work. I am so glad that I'm able, as a senior member of the Budget Committee, help to shepherd President Biden's American Rescue Act. As a senior member of that committee, the Budget Committee was the last stop to prevent any blocking of those dollars reaching our local community. And we had to fight it off. We fought off every attempt to stop the American Rescue Plan. And when it came out of our committee, it went straight to the floor of the House. And so we were able to, during that time, get it to the President's desk with budget reconciliation. And people have heard that word. All I can say is that we use the words, help is on the way. and we were able to pass $1.9 trillion that has generated into why we're here today, on $20 billion for vaccination, testing, and contact tracing, money that will come. So today, let me say 2 points, and I'm going to present these dollars that our leadership. Ms. Jenkins, you need to stand with us, and the supervisor, you'll be acknowledged, and you're doing a great work here.
Thank you.
Pharmacists, we can't do it. Pharmacists now are taking wings. Everybody's saying, now I know what a pharmacist does. We want to applaud the pharmacists. So we have tried to do outreach everywhere we can. Everybody knows that I started the no registration vaccination sites. I think they're all going to get to that now. We're doing another one on the north side on April 10th. We're reaching out to the Hispanic community, as we do all the time. But we are making sure that we get everywhere. The commissioner has been everywhere. The commission has been everywhere. The Harris Health is everywhere. We're going to be able to answer the call of President Biden. And so the 1.9 trillion, we were able to establish the federally qualified community health vaccination dollars, to add dollars to our community health facilities that are in neighborhoods. That's what we need to do, right? Is to go in neighborhoods. And so I'm very pleased to be able to present to the two commissioners and the Commissioners Court for the Harris Health System, $3,895,000 from our American Rescue Plan, and to acknowledge to the state of Texas federally qualified health clinics and to the 18th Congressional District. That's my total. My total to all of my clinics, $33,217,000. $33,217,500. And that means we're going to be vaccinating. We can call the roll very quickly. Acres Home Health Center, Casa de Amigos, Northwest Health Center, Pediatric and Adolescents Health Center. Some of these are all yours. Senegas Health Center, Thomas Street, the main office, Caroline Street Clinic, Legacy Health, Wellness Bar by Legacy, Bernard by Legacy, Montrose by Legacy is on the edge. And let's see, there's one more page here. All right. Then 5th Ward Legacy, 3rd Ward Legacy. So all of these are where we are going to be testing. Just believe it, that's where we're going to be testing, right in neighborhoods. And then to look at the pages, I can't do it all, but all throughout the state of Texas, we'll be sending money in rural communities to get out and get vaccinated. The whole idea is to get a shot in the arm. And I think we want to celebrate getting a shot in the arm. And I'm going to be a little humorous. I got the commissioner here. When you get a shot in the arm, you can go out and get on a bicycle, or you can get a basketball and dunk it into the basketball, into the goal. So shot in the arm, get on your bike, go to a park, get a basketball, and dunk a ball. How about that? That's what we're going to be doing. So I'm grateful for everyone. Let me acknowledge Brian McLeod, who is here, and let me acknowledge Dr. Portia, who is the Harris Health. Dr. Medina, you will hear from, and you'll hear from Dr. Smalls. We're delighted with Dawn Jenkins, who is director of Thomas Street. She has such a passion. She reminded me of our relationship. Nicole is here with the communications team. John is here with that team. And Stephanie Ramirez is the administrative director. We're so grateful for her. So at this time, can we have Commissioner Adrian Garcia come forward at this time? Thank you. Commissioner has been, I'm going to have to do this again, deeply committed in fighting COVID-19, from testing to vaccinations and to fighting to get more dollars down here to help those in need. We are so grateful for that. Commissioner Garcia.
Congresswoman, thank you very much. And I will tell you that we are so blessed to have Congresswoman Sheila Jackson Lee at the Budget Committee, because God loves anybody who's trying to get in her way from keeping a good bill from happening. That's going to save lives and save communities. So, Congresswoman Lee, thank you so much for your strength, your courage, and your commitment, not just to your congressional district, but to the entire United States, because so many communities are benefiting from your work. And let me also just say that these dollars are going to save lives. And as the Congresswoman just said, it's a shot in the arm. But these shots in the arms will be also a shot to support and strengthen our economy as well. To keep roofs over people's homes, make sure that people are employed and continue to earn money, and get our economy back on track. And so, Congresswoman, thank you very much. And I will also just say with my colleague here, Commissioner Ellis, that we're so fortunate to have the Harris Health System as a part of Harris County. So Dr. Medina, Dr. Small, we are so grateful for all of the work that you do. This particular facility has always been important to me, just because as many lives or many families are being touched by the death rate of COVID-19. My family was touched by the AIDS epidemic when it took my brother. And so recognizing all the work that you're doing here to save those lives, we're grateful. And so, but my colleague and I, listen, let me just tell people that, as the Congresswoman was alluded to, sometimes it's hard to raise the value of a human being just because they're human. But Commissioner Ellis has been fighting and been the staunch supporter of equity. And we will be getting to a day when we don't have to think about something else again just to cover the least, the lost, and with his efforts, we'll be raising all lives to be considered all equal. And so we're so fortunate. So, Congresswoman, thank you so much for your work. To all of the Harris Health System employees, God love you. Thank you for what you do. I'm so honored to work alongside you.
So good to partner with you, Commissioner. We will continue working with the federal dollars that are coming and coming soon. You know, we've got the American Jobs Plan, and that's another one that we'll be standing together on. Let me thank Commissioner Ellis has already been introduced. What an enormous fight of equity that he's had. And Commissioner, we will need you. We're planning on getting past that $2.25 trillion, and we expect it to hit local communities. I want us to be a shining star of diversity and recognition of economic empowerment for those dollars. $680 billion for transportation. So that's another topic. We're still doing the health care of $1.9 trillion that's already in your pocket. So let me just emphasize that money is already in your pocket, and we're doing things like expanding the ability to vaccinate. Commissioner, thank you for your work on all of these issues. Commissioner Rodney Allen.
Thank you, Congresswoman, and you picked the perfect place in Commissioner Garcia's precinct to have this event today. Commissioner, the Congresswoman called me this morning to say happy birthday to me. And then she said, I'm having a press conference and I want you to show up. I said, where is it? She said, Thomas Street Clinic. I said, well, that's in Garcia's precinct. I think she was thinking me because she and I go back to when Mickey Leland was leading the fight to make sure that this clinic was here. But it's such a historic place because they opened the doors and nobody else did. I want to say to the two doctors that are here with us how proud we are of them and the work that they do. Thank them very much for their work. Congresswoman Sheila Jackson Lee is the kind of person you want on your side when you're in a fight. And it was a challenge to get this funding. I wish that they've been able to get bipartisan support, but I'm so glad that they had enough support to pass it. And so this is serious money coming in our community. Commissioner Garcia, County Judge Lita Hidalgo, and all of us on Commissioner's Court appreciate it. We could not do it without the help of our Dean, Congresswoman Sheila Jackson Lee, this delegation, and President Biden. So that's my message. I want to say we appreciate you. We love you. Anytime you call, Adrian Garcia and I will show up. Thank you, Congresswoman.
So we are at the home of Harris Health, and we didn't come here without a story. And so now you're going to hear from the real leaders on this fight with COVID-19, who are heroes and sheroes. Many in their profession lost their lives. In the early stage of COVID-19, doctors lost their life, nurses, techs, hospital workers lost their life, pharmacists, because this deadly disease was wrapped up in denial of science, but we got back on our feet and we saved a lot of lives, and that's why we're sending this money here to save more lives. Dr. Mendez. Head of BidTalk, Medina. Excuse me, Dr. Medina, the head of BidTalk. Thanks for the senator.
Thank you, Congresswoman. On behalf of our CEO, Dr. Forza, and all Harris Health, we can't thank you enough for this support for all of you. What this means to us, and first of all, hats off to the team. We're here as representatives. The team in all of our clinics, in our hospitals, vaccinating people, testing people, our employees, those are the true heroes. They're also part of their community. Many of our employees actually live within those communities or grew up in some of those communities and now are their nurses, doctors of that same community. Very important to know. What this means to us, Harris Health, these dollars are going straight to those patients in that community that need it. The testing, more vaccines, more outreach, as Dr. Sheila Jackson Lee, Dr. Nacho.
Always wanted to.
As she mentioned, our locations are exactly where these people are needing it the most. Hispanic, African Americans. They're in communities where our clinics are. They don't have transportation barriers in terms of flexibility with their schedules. Very important for us to reach out to them. Most of our vaccines, over 80% of our vaccines are going to those communities. So this is very important for the work that we're doing. I want to mention also that we have partnered with infectious disease physicians from Baylor RUT that counsel us. We are blessed to have J&J, Pfizer, and also Moderna vaccines. All of those vaccines go to our patients, go to our community. They're all very, very effective with even the variants, and that's very important to know. So at this point, all these vaccines, again, will prevent you from getting COVID, or if you do get COVID, it will be a milder disease. So all of these have proven to be effective. I wanted to say that in Spanish, muy importante, todas estas vacunas son efectivas contra el COVID y todas las variantes. Tenemos doctores que son expertos en el COVID y nos han informado que todas estas vacunas son muy efectivas, inclusive contra las variantes, muy importante para nuestra comunidad hispana. So thank you very, very much. I can't thank you enough. Dr. Small here has been in charge of the vaccines, so I want to make sure she gives you more details of everything that we're doing.
I want to make sure that you heard that her name is Dr. Medina. And it's Dr. Lorimer. Yes. Did I have that right?
Yes.
Dr. Medina, we're so pleased. We're at LBJ and didn't get the commissioner out, so I snuck in there. And we were there the first day to receive the vaccine. And Commissioner, I think we're still going viral because we did the dance when those vaccines came in. So let me thank as well Dr. Jennifer Small, Senior Vice President. And we should be said that Dr. Medina is head of BidTalk Hospital. Looks like a lot of good things are happening. and Dr. Smalls is over this whole world of vaccination, doing an excellent job. So glad they were able to join me, that we can work together. And so let's hear the story from Dr. Jennifer Smalls.
Thank you, Congresswoman. All I have to say is thank you, and thank you. Thank you for remembering us. Thank you for acknowledging us. And thank you for continuing to fight for us.
Yes, yes.
You know, COVID made such an impact, and we hear it, and it's not anecdotal in our communities. And the fact that we were able to get vaccines, and we were able to stand up a record 9 locations within 2 weeks. Within 2 weeks. And now we've expanded so that we are making sure that our patients that are homeless, our patients that are homebound, they also receive our vaccines. So even if you can't meet us here, we'll meet you where you are. So again, we could not do this without funding, you know, from our local commissioners, from our congresswoman. Again, thank you for always remembering the work we do. With these dollars, we'll be able to expand locations, get additional staff so that we can put more vaccines in arm. This is a dream come true for Harris Health. This is what we need. Our patients cannot go to the other locations like the MRG. They just can't make it there. We have to be in the neighborhoods. We have to be where they are. And the fact that we'll be able to expand and be able to make sure that all of our patients throughout Harris County, as far north as Humble, as far east as Baytown, we'll all be able to see that. So on behalf of Dr. Porter, our CEO, and our Board of Trustees, again, we say thank you.
All right.
Well, let me just say as I close, we just had a teach-in, we just had a tutorial about the American Rescue Act. And we didn't hear it just from Commissioner Garcia with his leadership, or Commissioner Ellis with your leadership, or Congresswoman Sheila Jackson Lee. We heard it from our doctors, our frontline doctors, our pharmacists, our head of the Common Street Clinic that takes care of these persons who are now living. So I close by simply thanking Dr. Small. I'm thanking Dr. Medina, because the 3 million plus and the 33 million in your different clinics is going to help you expand your sites. It's going to help you use mobile units for the homebound. And I'm excited, it's going to help you vaccinate the homeless person. Those who are homeless are going to be vaccinated more with these dollars under the auspices of Harris Health. Yep. That deserves an applause. Homeless person. So we can say it. I know he can hear it. Yesterday, President Biden said April 19th. He's not going to wait till May to make vaccinations available to everyone. And you know Texas, and you know Harris County, we're getting out front. Right. We're making it available to everyone right now. And these federally qualified dollars through the American Rescue Plan is going to send this great health system out and about, expanding sites, having more vaccinations, helping the homebound, and helping the homeless. I don't think that we could have a better April, and of course in the aftermath of our very special Resurrection Sunday. So thank you all. I think I've acknowledged everyone. Kayanda, my good friend Gabriel Esperanza is here. We thank him very much, and we'll take any question at this time.
Here's my first question right off the bat is, are there any particular sites that come to mind that would be most abundant and be more effective to bring percentages up in regard to people getting vaccinated?
Yeah, I'm going to, the one thing about Harris Health and the City of Houston Health Department, I want to acknowledge Mayor Turner for his great leadership, is they got it quick. Early on, we were at Setagast and had a press conference. Setagast is Harris Health Clinics, that we were not going the way we should go in African Americans and Hispanic communities. So this is one that's in an economically needed and diverse neighborhood. We know that the one in Acres Home, the 5th Ward, Casa de Amigos, and a few others would be in those areas, but again, they're also going to shelters to help people and also to homebound. But let me allow Commissioner and others to comment. Whoever.
Okay, let me just. Thank you, Councilwoman. First of all, let me just say that if you look at any given map about Harris County right now, it shows an incredible disparity on who is getting vaccinated. And so these dollars will go to Commissioner Ellis's effort of equity in all regards. But let me just say that I'm grateful, so grateful that you chose Thomas Street Clinic, Congresswoman Lee, because Precinct 2 has always had particular challenges when you look at the entire precinct. With over 1 million people that live in Precinct 2, I have amongst the lowest medium income. I'm largely outside of the metro service area, so public transportation is not a norm for us. And I have amongst the highest number of children and families without health insurance. And then if you want to throw in the fact that I've got amongst the highest number of diagnosed cases of cancer and acute asthma, then it raises those challenges, and not to mention all the environmental challenges that we have. So these dollars are critical for all people of color, all people in general. But for Precinct 2, this is such a welcome shot in the arm, Congresswoman.
Thank you. All right.
I would only add to that, Congresswoman and Commissioner, the disparities are self-evident when you look at the maps. Now, what we have done in Harris County, our numbers are slightly better than our partners. Just slightly better than those of the city when you look at what we've been able to do in communities of color, by those zip codes. But it's still not enough. Our other partners have to do more. What the Congresswoman does and the Commission does with these sites, when you go out and you just show up, it helps. But Commissioner Garcia, I think he went to it. We don't have a culture in Harris County and Texas of going to the doctor. In part because Texas didn't take the money from the Affordable Health Care Act. So first thing I think about on April 7th is, I got to get all my checkups. You got me? That's how I measure it. And when somebody says to me, Rodney, you having a bad day, you know what I tell them? Try missing one. And the stats that she gave earlier indicate how many people are missing a day. So look, we're looking around the country, we're learning from what other people are doing, but we are doing more of these distributions where you just show up.
Yes.
But part of it is that systemic issue, this culture of not giving people access to insurance. So it's not a culture of going to the doctor on a regular basis. But any bright ideas anybody has, we're trying. This money's going to help, but we're out there, we're using public figures, with political figures, whatever works, to get people to get it, to get a shot in your arm.
Yeah, shot in the arm. Thank you.
If you don't mind, I'd like to change the subject if I may. Here in Houston, have you received a status on the unaccompanied minors that have entered into the Houston site?
Do you have, is that your last one?
I'm sorry?
Is that the last one?
Questions?
Yeah, no.
I have 2 or 3 more.
Are they on unaccompanied? Are they on unaccompanied?
Yes.
Okay. Would you allow us to just take our picture and I will answer your question, okay? Let me indicate that the Commissioner has said something that has been included in the American Rescue Plan, and that is the opportunity for expanded Medicaid. It's complicated, but that's a component that we need to look at. I need to look forward. It is in that legislation to add resources for expanded Medicaid for those who have not selected it, but of course it takes some way of trying to access those dollars. But you're absolutely right that we were denied the full comprehensive Affordable Care Act. A lot of people now, we all look into the Medicare for All for that very reason. Because this state did not take the expanded Medicaid. President Biden is going again to make that attempt. So let me say how grateful I am to be here, and what we're going to do is to stand here to acknowledge the 3 million and take our picture right in front, and the 33 million, and then we will address that other question. Thank you all so very much.